All right, so today we're going to be taking a deep dive into, those potential changes that might be coming to American healthcare. Yes, specifically how things could possibly shift within the Department of Health and Human Services.
Sure.
Under the Trump administration. So we're drawing insights from a Topic Like Policy Insights podcast episode. And it's called Health and Human Services Under Trump, What's Coming Next? And our goal today is to give you a really solid understanding of these potential changes and like what the ripple effects could be throughout the American healthcare system.
Yeah, and I think one of the things that's really fascinating is the appointment of Robert F. Kennedy Jr. as the new chair of HHS. Kennedy is known for his advocacy for reducing pharmaceutical influence and for increasing transparency in healthcare, especially when it comes to vaccine safety protocols. And this has been reported by various outlets, including Politico. And his stance has often kind of put him at odds with like mainstream public health practices. So, his appointment signals the possibility of some pretty significant policy shifts.
Right. So to get a better grasp on the potential impact of Kennedy's leadership, it's helpful to understand a little bit more about the Department of Health and Human Services. So HHS oversees crucial agencies like the Centers for Disease Control and Prevention, also known as the CDC, the Food and Drug Administration, FDA, and the Centers for Medicare and Medicaid Services, CMS.
Right, and each of these agencies plays a really vital role. The CDC is responsible for protecting the public from health threats. The FDA makes sure that drugs on the market are safe and effective. And CMS manages Medicare and Medicaid, which are the massive healthcare programs that cover millions of Americans.
And given Kennedy's he has expressed skepticism in the past about the relationship between the pharmaceutical industry and agencies like the FDA. This was reported by Reuters. So his leadership could mean increased scrutiny of the FDA's drug approval processes and potential changes in how the CDC communicates with the public, especially when it comes to vaccines.
Yeah, I think that's definitely an area to watch. One key area where we might see some immediate policy changes is vaccination. During his campaign, President Trump spoke a lot about giving states more power over vaccine mandates. And, this aligns with Kennedy's views on what he calls medical freedom. And this has led to some speculation. And outlets like the Washington Post about a potential relaxation of vaccination requirements at the state level.
Right. That raises the question of how such a shift might impact herd immunity and whether we could see, like a resurgence of preventable diseases in areas with those relaxed requirements.
Yeah.
And public health experts at Harvard Health have voiced concerns about this possibility.
Yeah, for sure. That's a valid concern. Another major area to watch is Medicare and Medicaid. President Trump's emphasis on, what he calls market-driven healthcare solutions. This is noted by the Wall Street Journal. This could translate into some new models for Medicare. And Kennedy's focus on reducing bureaucracy could lead to more emphasis on privatization within these programs, with the goal of making healthcare, quote-unquote, more consumer-focused.
Yeah, but that raises the question of whether a quote-unquote consumer-focused approach would actually benefit everyone. Like, for example, would low-income individuals who rely on Medicare and Medicaid, would they face higher costs or, have difficulties navigating a more privatized system?
Right. Those are really important considerations. It's important to think about those potential downsides. While increasing choice in healthcare might sound good, it's crucial to make sure that those choices are actually accessible and affordable for all Americans.
Exactly.
It's about striking a balance.
Yeah, absolutely. Okay, so let's dive into some more specific examples of how these potential changes might actually play out in the real world.
Okay, sounds good. So let's start with vaccinations. We've been talking about states potentially getting more control over their vaccination mandates. So imagine a scenario where some states, they choose to relax the requirements, but other states decide to keep stricter standards in place. That could create kind of a patchwork of regulations across the country.
Yeah, that's a really interesting point. So what happens then if a family moves from a state with, those strict vaccination rules to a state with more relaxed rules? Would they have to update their child's vaccinations to meet the new state's guidelines?
Right, exactly. And that's just one example of the kind of situation that could come up.
And how would that impact school enrollment? Would schools in states with, those relaxed requirements, would they see more unvaccinated children? And could that then lead to, localized outbreaks of diseases that we could actually prevent?
Yeah, those are really important questions. Policymakers and public health experts are going to have to figure out how to address those things. Because, the potential impact on herd immunity and the possibility of preventable diseases coming back, those are serious issues.
For sure. Okay, so let's switch gears a little bit and talk about Medicare and Medicaid. We talked earlier about President Trump's, he's interested in market-driven solutions to try to lower healthcare costs. And so this could involve bringing in more private sector involvement into these programs.
Yeah.
Through things like Medicare Advantage.
Right. And the people who support privatization, they say that it can give people more choices and maybe even lower costs. But critics are worried that it could also mean higher out-of-pocket expenses for the people who are actually using these programs. It can be really difficult to navigate all these different private insurance plans, especially if you're not familiar with how health insurance works.
Exactly. Imagine like a senior citizen on Medicare.
Yeah.
You have to choose from all these different private insurance plans. And what if they pick a plan that doesn't actually cover all of their medical needs? They could end up facing huge financial burdens.
Exactly. And that brings up concerns about fairness and access. Will a more privatized system really help low-income seniors? And what about people with complicated medical conditions? Or could it actually make the differences in healthcare even worse?
Yeah, that's a big concern. And another thing to think about is that increased privatization could lead to more fragmentation in the healthcare system. If more and more private insurers are entering the Medicare and Medicaid markets, it could get really hard to coordinate care between all the different providers and plans.
Right. And that fragmentation could lead to gaps in coverage,
Yeah.
even breakdowns in communication, which could really impact the quality and continuity of care that people receive.
So it seems like the potential changes to Medicare and Medicaid, they're really complex. And there are a lot of different aspects to consider. There are potential benefits, but also some real drawbacks. And policymakers will need to be really careful about how they balance all of those things as they try to create a healthcare system that's affordable and accessible for everyone.
Absolutely. And I think it's helpful to take a step back and think about the bigger picture here. Like, what kind of healthcare system are we actually moving towards?
Yeah, that's a good question. It seems like we're moving toward a system that puts a lot of emphasis on individual choice and market-driven solutions, which could mean more options for consumers, but it also means more responsibility on them to understand those options and to manage their own health care.
Yeah, I think that shift could have a really big impact on the relationship between doctors and patients. In a more consumer-driven system, patients might be expected to play a much more active role in making decisions about their own health care.
Right. They might need to know more about their health insurance options, treatment options, and costs. And while that could help patients make better choices, it could also create challenges for people who don't have the time or resources or the health literacy to navigate such a complex system.
Exactly. And how will this shift affect healthcare providers? Will they have to change how they practice medicine in order to adapt to this new model of healthcare delivery?
All right, those are all important questions that healthcare professionals and policymakers are going to have to address as the healthcare system keeps changing.
It's definitely a time of a lot of uncertainty, but also a lot of opportunity. And I think it's really important that we have these conversations, thoughtful and informed discussions about what we want the future of healthcare in America to look like.
So as we wrap up this deep dive into the potential changes within HHS under the Trump administration, it's important to remember that we've really just scratched the surface here.
Yeah, we've talked about the possible implications of Robert F. Kennedy Jr.'s appointment as the HHS chair, and we've delved into those potential shifts in vaccination policies and looked at the complexities of bringing market-driven solutions into Medicare and Medicaid.
Right. We've also considered those broader implications of these changes and the kind of healthcare system we might be moving towards.
Yeah.
One that emphasizes individual choice and market-driven solutions, but also demands greater responsibility from patients.
And it's pretty clear that the healthcare landscape is changing a lot, and navigating all these changes is going to require careful consideration of both the potential benefits and the drawbacks.
Absolutely. So the key takeaway for you, the listener, is that staying informed and engaged is crucial.
Yeah, whether you're a parent who's worried about vaccination policies, a senior citizen on Medicare, or just someone who cares about the future of healthcare in America, your voice matters.
By staying informed about policy developments, understanding how they could impact you, and engaging with your elected officials and advocacy groups, you can help shape a healthcare system that works for everyone.
Remember, knowledge is power, and in this case, it can really empower you to advocate for a healthcare system that is both affordable and accessible for all Americans.
Well, that brings us to the end of our deep dive. We encourage you to keep exploring this topic, stay informed, and make your voice heard.